Could you please explain how to diagnose endometriosis?
Yes, so the endometriosis we diagnose first based on the symptoms. We ask patients if they have a symptoms of endometriosis, which is pelvic pain, so constant pelvic pain, which gets worse during menstrual period, and pain during intercourse. So these are the pain symptoms of endometriosis. Also, endometriosis can cause heavy period, especially if it coexists with adenomyosis. In adenomyosis, uterus gets swollen, big, and then the patients have a bigger surface volume of endometrium, which is endometrial lining, and they tend to have a heavier period. So these are some of the symptoms of endometriosis, and also infertility itself is one of the symptoms of endometriosis. So like we said, 25 to 50% of women with infertility have endometriosis. So just simply the fact that patient has endometriosis doesn't necessarily mean that's actually cause of infertility. The actual cause of infertility may be different, but endometriosis may be coexisting problem. And a lot of patients, endometriosis itself doesn't cause infertility. It can reduce the fertility, but is not the main cause. There's additional cause for the infertility. So maybe low egg reserve or female age, maybe sperm parameters, or blocked fallopian tubes. There could be different causes, but in some patients, actual endometriosis is the cause of infertility, especially in patients with stage 3, stage 4 endometriosis, and patients who have ovarian endometriosis, like chocolate cyst, and patients who have adhesion scar tissue formation around the fallopian tubes. So for these patients, actual endometriosis may be the cause of infertility. This is why we take a history to diagnose. We ask all about all the symptoms, and also infertility itself. In patients with infertility, we suspect they may have endometriosis. So then next level of investigation is pelvic ultrasound scan. So you can have two different type of scans. Simple pelvic ultrasound scan, where you just do full scanning, check if there's any chocolate cyst, which is the ovarian endometriosis, we call endometrioma, whether there is any significant endometriotic nodules in the pelvis. So, but the simple scan can easily miss endometriosis, because you may not be able to see the nodules properly in simple scan. But in deep pelvic ultrasound scanning, which is specifically designed to detect severe endometriosis, you usually pick up the endometriosis. And deep pelvic scan, of course, you scan ovaries, and if there's any chocolate cyst, you should be able to pick up. And also you scan inside the pelvis, and you can check if there's any endometriotic nodules. Certainly, deep pelvic scan can diagnose stage 3, stage 4 endometriosis. Stage 3, stage 4 means you have a lot of scar tissue in the pelvis. Stage 1 endometriosis is very mild endometriosis, and it's very superficial, and you may miss even in deep pelvic scan. Stage 2, some nodules you can pick up on deep pelvic scan. In some patients, especially if they have a stage 3, stage 4 endometriosis, if you're planning to do laparoscopy, they may need to do MRI to have a proper investigation of state of endometriosis before they do laparoscopy. So history, ultrasound, and MRI. But the gold standard for diagnosis of endometriosis is, of course, laparoscopy. Because on laparoscopy, you directly visualize the pelvis, and you check systematically all areas of the pelvis to check if there is endometriosis. So you can diagnose whether there is endometriosis. Second, you can stage whether it's stage 1, 2, 3, 4, and you can tell where the nodules are. And at the same time, of course, you can treat the endometriosis by removing, excising those endometriotic cells and endometriotic nodules area with endometriosis. So laparoscopy, of course, is a gold standard for diagnosis of endometriosis.